Can supplements reduce COVID-19 risk in women? Researchers at King's College London in the UK analyzed data from 1.4 million users of the COVID symptom study app in UK, United States, and Sweden. The study was observational and has not yet been peer-reviewed. And again, observational means it wasn't a randomized clinical trial. They just looked to see who'd been taking these things, these supplements. And then they looked to see how often they were getting COVID. Was taking these supplements a risk factor, so to speak, for not getting COVID? What did they look at? Well, probiotics, multivitamins, omega-3 fatty acids, vitamin D, vitamin C, zinc, and garlic supplements. And they did see a decrease. Over 300,000 patients took a PCR test. That's the polymerase chain reaction is what PCR stands for. And it's basically just looking at the genetics of the virus. Those of you who know that test know that, yes, there are some problems with it, but yes, you have to understand the pros and cons of anything when you're using it. I've used the PCR test. In fact, I used to work for a genetics lab. Researchers found an association between taking some of the supplements and a reduced risk of having COVID-19, but only on the women. So it's like, why would that be? They don't know. Probiotics were a 14% reduced risk, multivitamins a 13% reduced risk, omega-3 fatty acids a 12% reduced risk, and vitamin D a 9% reduced risk. Taking vitamin C, zinc, or garlic was not really associated with any reduction in risk. Similar results were found between supplement use and confirmed SARS-CoV infections for the app users in the US and Sweden. Several studies have found that female patients have more robust immune systems, and many of us with some genetics background, like myself, think that it might be associated with the lack of genetic material that men have in the Y chromosome, for those of you who are interested in connecting those kind of dots. Anyhow, for women, this means that their immune defenses get more of a boost, may get more of a boost from supplements. Women who purchase vitamins may be more health conscious than males. And, that may be the mechanism. They may be more likely to wear masks or wash their hands. A major concern is that these findings may be confounded by socioeconomic status, given that individuals of higher status are more likely to take supplements and are also less likely to become infected. Now, they end the study, any of you that have read any science, if you've read one article and you've heard it once, you've heard it with almost every article you're going to read. Large randomized controlled trials are required before any evidence-based recommendations can be made. In other words, more research needs to be done on supplements.